Now let's talk about financing immunization advocacy response. And it's a project that the Ghana Health Service has partnered with Hope for Future Generations for. In the studio with me to get the details out is Mrs. Eunice Joantia Jagli. She's Regional Health Promotion Officer at Ghana Health Service. And then Dr. Mrs. Nancy Ansakoba. She's Director of Programs, Hope for Future Generations. Welcome to the program.
Thank you.
Let me start with you, Mrs. Koba. Tell us a little bit about Hope for Future Generations and this wonderful project you've got coming on.
Thank you very much and good morning. Hope for Future Generations is a national level, non-governmental, not-profit organization, not-for-profit organization. We work to improve the health, education, and socio-economic status of women, children, and then young people. And when you look at what we do, and we look at health, and we look at children, we look at women, then definitely we'll be talking about immunization. And this morning, our key interest is financing Immunization Advocacy Response Project. And also, like, we will also look at the immunization week. But then the financing Immunization Advocacy Response Project has three main objectives. The first objective is to advocate for increased domestic resource mobilization for immunization. As we know, or as we may already be aware, some part of our immunization is financed by donors. Right. But it's important that we increase our own domestic resource mobilization because by 2030, Gavi, the main donor, will exit and we will need to look at it.
All right. Before we continue the conversation, I want to bring in Mrs. Tia Jagli in the conversation as well so that we can all talk about the important details. You're from the Ghana Health Service and you've partnered with Hope for Future Generations on this wonderful project. What's the intention behind this partnership from your end?
Thank you. Good morning to your cherished listeners. We, as Ghana Health Service, have the mandate to ensure that every child is immunized against all vaccine-preventable diseases. So our partnership with Hope for Future Generation is to ensure that during this period, that's the last week of April, where we observe and commemorate African Vaccination Week, and the first week of May, where we also do Child Health Promotion Week, and they are talking about immunization. How do we get these commodities? We are talking about come out and ensure your child is immunized against the vaccine-preventable diseases. You monitor the growth of your child. You ensure that your nutrition is well enough to give the child the best of growth. We give counseling for you to know what you should do for your child to have the best of growth mentally, physically, and then emotionally. So we do all this. That is to be sustained with financing. So that is where the Hope for Future Generation comes in to ensure that the needed financing is secured for us to have all we need to be able to offer these services to our clients at the right time, in the right quantity.
Does it mean that we have challenges with financing when it comes to immunization? Because I'm looking at the theme for this year, and you say it is immunization for all is humanly possible. But the broader project is financing immunization advocacy response. Is there a gap in the financing?
Yes, there is a gap. And that brings me to the second objective of the FAIR project, that usually release for immunization financing delays. You know, the government is supposed to release its co-financing obligation, and the arrangement is that by the end of the first quarter of the year, these co-financing obligations should have been fulfilled so that vaccines could be procured. But there are delays usually, and when the delays happen, it means that vaccines cannot be procured in time. These are also issues we look at. We are also looking at having enough domestic resources so that by the time that Gavi will exit by 2030, Ghana can achieve vaccine sovereignty. That is that we are able to take care of all the financial needs of our vaccine. So these are some of the key issues that we are looking at. And this morning, we would like to call on decision makers to ensure that co-financing obligations are paid. The money that should be paid is paid so that we can procure vaccines and ensure the immunization of our Ghanaian children.
Okay.
This is critical.
It's a great call, really, and I hope that all the appropriate authorities and bodies, and even philanthropists, can come to your aid when the time arises. And Mrs. Jagli, let's talk about the uptake of vaccination in the country. What is the response? You say that this is the last week, or this is the week for immunization. Tell us about exactly what's happening, the details, and how people are receiving your message so far.
Thank you. Vaccination is year-round activity. That a child under 5 years must get all the 14, as at now we have 14 vaccine-preventable diseases that children are being immunized for. And the month of April, the last week, and the first week of May, as I mentioned, are just set aside to advocate and then mobilize, sensitize people to know the importance of these services.
So it's not like you're vaccinating this week.
No.
You're just advocating, creating awareness, sensitizing the populace.
And then in addition to the advocacy and then mobilizing people, we also look at places where it has been difficult to reach people, maybe people in ghetto who not come out for regular immunization. Those hard to reach community, we identify them, we make ourselves available to them at their places so that whatever vaccines their children have missed in their age group is provided, and those who have not had the opportunity to do the growth assessment, all the services that they are supposed to do at the place we call weighing for children is also offered to them at wherever they are. Those are the mining areas where parents feel they are too busy to take them out for vaccination. We reach out to all these people to provide them the needed services. And it is all to help us to reduce the mortality and morbidity among children under 5 years, and as such help to build a healthy community where the government and we, the individual, will not spend money and other resources to manage diseases that are preventable. Would have been prevented.
Great point. So, I mean, I know you said that the main purpose of you coming here is to reach out to those financing. But this week, whilst we are sensitizing, creating awareness on vaccination, Mrs. Koba, what is the core message that you'd like our audience to take away from? And this is the final take, we have to go.
Okay, that our message will be to our decision makers that we should pay our co-financing obligations of about $70 million should be paid so that we can procure vaccines. And government should also even plan ahead to be able to pay our co-financing a year ahead so that we can plan and ensure that all our children are safe.
Thank you so much. Mrs. Eunice Joan Tia Jagli is with the Ghana Health Service, and we also have Mrs. Well, let me take that again. Dr. Mrs. Nancy Ansakoba is Director of Programs, Hope for Future Generations. And then we also have from the Ghana Health Service, Mrs. Eunice Tia Jagli. She's Regional Health Promotion Officer at the Ghana Health Service. Thank you, ladies, for coming, and I wish you the very best.
Thank you.
Thank you for the opportunity.
Thank you.
Well.